you know, pains and ache, you know, and then we've been treating our lower back, you know.
Dr. Lau, there's one question I did want to ask. People will ask, how safe is it? In other words, you know, they're very conscious these days about infection control and needles.
Right.
How safe is it? Are they sterile needles? Or?
Well, actually, they are not sterilized needle, but they're disposable needle.
Oh,
you know, you're using it once, one time, you know. And now, how you judge whether, you know, it's safe or not is very simple. Ask me about my malpractice insurance. You know, my malpractice insurance is less than $1,000. Whereas my daughter, who is a pediatrician, she's paying a lot more, 10 times or more, or 20 times more.
Wow.
So that shows you that how safe acupuncture. Actually, you know, as far as I know, we never been sued before. Not only me, but then the whole profession.
Right. So it's like a holistic, a whole round, viewing the whole person instead of just the disease.
Right,
Absolutely.
right. We treat the person holistically instead of treating one symptom, you know. So when we treat you, we actually improve your immune system, and we're going to try making sure that, you know, the chi, which is the energy of the blood flow through your meridian system. That's why we bring this.
We have Adam.
Adam in the garden.
We don't have Eve, we just have Adam.
You know, if you know the blood flow and then the chi flow is harmonious, there's no impeachment, no stagnation, then, you know, naturally your body can heal itself.
And so you put the needles and you have specific places for specific reasons?
Right. That's how acupuncture works. And normally what we do would be that before we treat you, you come in, and then we're going to be asking along your health history. And then, of course, we would be asking a lot of questions, and then look at your tongue, feeling your pulse, and then listening to you. And afterwards, then, you know, we determine that, you know, where to put the acupuncture point, because most of the time it is some kind of a stagnation or some kind of some chi is not flowing, you know, the way it's supposed to flow.
Right. What is a chi?
Chi is, you know, energy, we call it, you know. And chi and blood we always put together, and that's why, you know, we said that we have a 12 major meridian, and then another less major meridian, and in this picture, in this atom itself, there's 316 points.
Wow. So they're pressure points, right?
Pressure points.
God.
Wow.
Wow.
And we have to learn all of those, and then, and of course, you know, there are more acupuncture points than 306, because as time goes by, you know, there are more and more points that they discover.
So if somebody comes in, say, for an injury that they have, is there a certain, do you know how many visits they need to come for? Do they come for maintenance? Like, what would be, for our viewers who might be hearing this for the first time, what kind of, what would they look forward to? How would that work?
Okay. I have to say that, you know, we are different from Western doctor. Western doctor would give you a pill to take, you know, a Lortab or hydrocodone for pain, you know. But for us, you know, because it's your own body that producing the painkiller, producing the anti-inflammatory hormone, producing the muscle relaxant, you know, and that's why
it comes naturally. The body does that.
Your body, you know. Producing it, we stimulate it so that your body actually producing, like you just mentioned, beta endorphin, corticosteroid, GABA, you know, those are just a few. Those are mostly for pain, for muscle relaxation, and so because the amount it produces is small, you know, that's why you have to come here a few times, and it's not uncommon that you have to come here 6 or more times. Almost, you know, most patients will come here, I would say, you know, 6 and more.
That's
now, does that interfere? Oh, I'm sorry.
I was going to say how wonderful it is, as the doctor said, that you don't have to take, you don't want to just stop all your medicine. You want to come and talk to Dr. Lau first. But the nice part about it is every time you take a prescription pill for one thing, it has side effects for like 10 other things.
Right.
And what Dr. Lau is saying is when you put the needles in specific places for your specific needs, that it helps to release and stimulate the areas that, so you're producing your own healing. So there's no side effects except better health.
And it's not foreign to your body either. No. Body recognizes it as its own self.
Yes.
Which that's what you want. But my question is if they are, like, say, on high blood pressure medication, would the acupuncture interfere with that? You know, leading on to Anna Marie's question.
Okay. Well, if you are taking, you know, some say calcium channel blocker or beta blocker and so forth, you know, and then we ask you that you consult your doctor, you know, before you stopping it. Actually, we will ask you to continue using it, until, you know, your blood pressure goes down. Because acupuncture does lower your blood pressure. Actually, it regulates your blood pressure.
Wow.
Also, and we also have herb that, you know, that would be also useful for lowering your blood pressure. And we did treat patients that whose blood pressure is high, and then we would not only acupuncture, we would be giving them herb, and then we would instruct them, you know, more exercising and what to eat and so forth. And then a combination of those is going to lower your blood pressure. Yeah. It's not something that, you know, people said that, wow, you know, how can it be? But actually, I always told my patient, even if you're diabetes type 2, you know, actually I treat quite a number of people who are diabetes type 2.
Now, does that lower their blood sugars?
Wow. Well, it actually, you know, we help you, you know, to losing weight. For instance, we're helping you to, you know, eat the right kind of a vitamin, because I'm also pretty big in asking people to take some kind of antioxidant, fish oil, you know, and so forth.
Is fish oil good for you?
Yeah, it would be. Yeah, it's good for raising up your high density lipoprotein. HDL.
Yep. And garlic.
Oh, garlic
is
good.
I do the garlic
cinnamon is also
morning.
good.
Yeah, cinnamon in my oatmeal.
Cinnamon, yeah.
Garlic and oatmeal sounds real good. Huh? But see, folks, here it is again. You have to be proactive in your lifestyle.
Exactly.
And you know, I've talked a lot about minerals and vitamins and a holistic lifestyle, and you have to start somewhere. You know, sometimes if you haven't been thinking about some of this stuff, you got to start somewhere. We always talk about putting down that soda, start drinking more water. You know, get in touch with Dr. Lau and some of the other sponsors that you hear us talk about, because it's all about taking responsibility. You don't have the magic cure. You can't go in and do what you want to do and get a couple needles and be all okay. You got to work together.
Oh yeah, you definitely the case.
It's collaborative, in other words.
Collaborative
You work
together,
with your physician.
and you have to be persistent in what you're doing. Because a lot of time people give up too easily, because they would, for type 2 diabetes, they would rather taking some, you know, glucophage, you know, and so forth. And it's easy way out. But that, you know, but I'm telling you that, you know, I work with a number of patients, and I told them that you have to walk, you know, I told them that 10,000 steps is the minimum. And then people who are losing weight, people who are getting type 2 diabetes, they will be doing over and above. And so I have patients that talk to me saying that, oh my goodness, you know, I've been walking for, you know, 30,000 steps a day, you know, and then I've been taking, you know, what you suggest me taking, you know, and I've been eating right, you know, instead of eating all those, so to speak, the junk food, you know. Then
your culture, though, does not eat, I noticed this more than once, does not eat junk food. I very seldom see an overweight Oriental person. I really don't.
Well, after they come to this country, they become overweight.
Blame it on America.
Somehow I knew you were going to say that, because it is, our diet is so bad. And I know, too, that I have some friends who are from China, and they say when you go into the Chinese restaurants, they just have the white rice out. She says, we don't eat the white rice. At home, we make the brown rice. Because when I tell you, nothing white, no white sugar, white flour, white rice,
potatoes,
everything, no white. Sweet potato is much better, sweet potato. But yeah, brown rice, brown flour, rice milk.
You know, that's good.
Yeah, rice milk.
Sea salt.
Yep, sea salt.
Sea salt.
With Chinese herbs. And this is, like the doctor said, thousands